So in the last 2 or 3 years, deep plane facelift surgery became almost synonymous with facelift surgery. And a lot of surgeons are claiming, oh, I do deep plane just because it's almost en vogue to say it. And I doubt that everybody who is doing or claiming to do deep plane facelift surgery is actually doing deep plane facelift surgery. Controversial opening for this post. Now I have your attention. Now, why do we call it deep plane? Well, first and foremost, we have to understand a little bit of anatomy. And we subdivide the facial layers into 5 layers. The top layer, number 1, being skin. The layer underneath is called level 2, which is subcutaneous tissue. Then we have the musculoaponeurotic tissue, which is also known as SMAS, as level 3. Then the level underneath is where we have some spaces. Yes, scary, but there are some spaces in the face, and I come to these in a second. And some ligaments in between those spaces holding everything together. This is level 4. And then we have deep fascia, which is a membrane covering everything up, or the periosteum. So this is another type of membrane covering the bone, level 5. Now, a lot of facelift techniques, especially the ones that have been introduced 60, 100 years ago, and still used today by many surgeons, by the way, these were all techniques that worked subcutaneously in level 2. And this is what we could nowadays call superficial facelift techniques. And then a deep plane facelift is basically going into level 4, working sub-SMAS in the spaces and working on the ligaments. Now, why is that so important, and why are these spaces so important? As you know, I like to use analogies to break down complicated things into simple concepts. Let's not use a 5-layer model, let's break it down into a bed. We have a bed frame, a mattress, and a duvet cover. The duvet cover is the skin and the subcutaneous layer. The mattress is the SMAS, and everything underneath the mattress is level 4, underneath the SMAS, on top of the bone. So superficial facelift techniques is like pulling on the duvet. It looks great, it's smooth, fine. Now the problem with aging is your face ages all over the place. Not just in one area, but everything goes down, everything deflates and descends over time. And what I mean with that, it's just like a sheet of snow starting an avalanche or going off a roof. Everything descends at the same time. So it's not just the duvet cover that goes down, but think of the mattress also being shifted off the bed frame. And this is where the jowl formation is, because the mattress is now hanging off the bed frame. Now, if I'm just pulling on level 2, the duvet, it will look good for a while, but it doesn't really do a lot on the mattress. So patients that are having a level 2 facelift will end up with a pleasing result for maybe 6 months, maybe a year, but after 1 year, maybe 2 years, suddenly the jowls are back and everything is just coming back. Why? Because they have never been corrected. Aging is happening in level 4. Because remember what I said, we have some spaces there. So these are gliding spaces. We have some ligaments that hold everything in place so it doesn't drop. Age-related, it still goes down. So when we do deep plane, we go into the right plane and we pick everything up and bring it up. In order to correct it though, we have to release the ligaments. So think of it, in analogy of the bed, as not only pulling on the duvet, but actually grabbing the mattress and putting it up again into the shape of the bed frame. So everything is aligned. And this is what we call a crisp jawline. And at the same time, we can also correct the duvet. So that's why a deep plane is more powerful and anatomically more sensible, because we actually go into the area and fix where aging occurs, rather than just pulling on another area to kind of blend the effects of aging and make it look younger without really understanding and respecting the protocol that aging is using, and that is SMAS and everything above level 4 going down. Deep plane is level 4, and I think this is the way you have to work it.